is Kelley Brummett, and I'm a dentist in Duluth, Georgia. And I'm talking here today with you about some products from DMG, Luxatemp in particular. And I want to share with you one of the ways that I use Luxatemp, not just for provisionals after I have prepped teeth, but also for case development and case acceptance conversations about projected treatment. So what I mean by that is oftentimes when a patient seeks us out to help them either change their teeth, change the color, change maybe the shape of their teeth, as well as help them understand and help us understand what's going on with their function, that if somebody has severe wear, if somebody has chipped their teeth, why that's happening, and we will take diagnostic x-rays, obviously diagnostic photos, develop a plan of action to meet their goals related to their aesthetics and meet our goals related to function, and share with them how that function really dictates the aesthetics. And so I will, once I gather all my information, typically a scan with iTero, photos, I will send everything to my lab, and then we will develop a plan of action to picture that end in mind of what the patient's desiring, but what will fit, one, within their face, but also functionally in their mouth. So whenever I receive a wax up back from the lab, there's a transfer of information that's really can be beneficial, and in my experience has been very beneficial to communicate with the patient about possibilities. So what we will do is we show them their original models. So these are printed models of a patient that I worked on. These are her before. Then we show her the waxed up model, how it can look aesthetically different. But it's not just about the aesthetics, because the whole idea that I want to help my patients understand is we want something to be predictable and have longevity. So we can make anything look pretty, but let's make it last. And so what we'll do is the lab will give me a stent. This is a 2-step stent. So they lined it, and I will actually put that, I'll have the patient in the chair. I will actually put the Luxatemp B1 is my favorite color because I want it to be brighter than their natural tooth color. And I will put the wax up design on top of their teeth. No bonding, no etching, no nothing. Put it right on their teeth and take it out and let them look at it within their mouth. I also will take photos of that, look at a few functional photos, especially protrusive, some crossover, and just get a bird's eye view of how close we are with, if we're going to lengthen, if we're going to widen, if we're changing line angles, if we're happy. Because that can give me an idea about whether or not I need to rediscuss the wax up with the lab, or what kind of changes I might anticipate in the patient's mouth. This is a great way to get your patients to accept treatment because they can visualize it. So utilizing your temporary material for case development, taking the opportunity to take the wax up from your counter or from your models to the patient's mouth in order for them to see it, feel it, as well as to start moving around with it, is a huge help for our patients to really decide whether or not they want to invest in their treatment. It's hard for me to imagine sometimes what somebody's planning for me. Like, for example, if I'm redoing my house, and sometimes I need to see examples or I need to see things. Well, when our patients get to experience those examples within their mouth without an obligation to begin, it can be really beneficial for your case acceptance. And then that builds your repertoire and your credibility behind developing more cases for other patients. So I utilize the best, which is the Luxatemp, because I want my patients to experience that. Because my hope is it'll help them engage. It'll help them invest in that future end in mind that they came requesting. Thank you.